Hello and good afternoon, everyone. I hope all of us are doing well and staying safe. My name is Dr. Aruj, and with me is Dr. Adnan. We are today going to conduct some mock scenarios. We'll be conducting two scenarios, and we will be randomly choosing some people from the audience, the candidates who will be performing with us. And I'll be just giving a small overview before we move forward so the others also, or the beginners also understand what this mock is all about or how we're going to conduct it today. Okay, so we will be choosing one of the candidates. The candidate will be given 90 seconds as in the actual exam to read the question, to read the scenario, and the candidate will be informed after 90 seconds to begin the station. We will be using the kind of the tone or the actual what you hear there, so that it will be easier for you to understand how to play there. One of us, me or Dr. Adnan, will be playing the role of a simulator, and the other one will be keeping the timer and also scoring you or giving you the feedback. So it's just a mock scenario. There's nothing to be afraid of. You can be calm and confident. You can be relaxed, and later you'll be given a detailed feedback. So if you have any questions in between, I would expect the rest of the audience to please leave your questions in the chat box, and by the end, we will be answering those for you. And another humble request, please do keep your mics mute because that causes some irrelevant disturbance in between. And with that, I would like to start with the first scenario. So who are we going to choose for the first scenario, Dr. Adnan?
Hello, everyone. Good afternoon. Thank you, Dr. Aruj, for a brief overview. From the audience, we have randomly chosen two candidates. One is Dr. Nisha and the second one is Dr. Ishwari. So the first mock, we'll give it to Dr. Nisha.
Okay, all right. So Dr. Nisha, are you there with us?
Yes, I am there.
Okay, all right. So once I show you the screen of the next scenario, I will be starting the 90 second, Dr. Adnan will be starting the 90-second timer.
Right.
Okay, so there you go.
Begin the session.
Uh, Hello, I'm Dr. Nisha Bharadwaj. My GMC number is 1234. Hello,
Hello.
uh, I'm Nisha, working as a junior doctor in the GP clinic today. Are you Mr. Peter Smith?
Yes, doctor, that's right.
So, how would you like to call? How should I call you?
You can call me Peter.
Okay, can I confirm your age, Peter?
Yes, I'm 65.
Okay, so how can I help you today?
Well, doctor, you see, I have this pain in my back and it has been there for a long time now. So I just got worried. I decided to see you today.
Uh, uh, I would like to say that, Peter, you have done a very good job by coming to the clinic today. So, are you comfortable in talking to me?
Yes, I am.
Okay. Okay. So, could you tell me something more about the pain?
Well, what do you want to know, doctor?
Where is it exactly? Can you point it like it's in the upper back, lower back? Which part of the back?
Yes, doctor, it's here in the lower back.
Okay. And since how long it's you are experiencing this pain?
Well, it has been there for around 2 to 3 months now.
Okay, that's a pretty long interval. Okay. So, what type of pain you're feeling? Can you just describe it in words? Like, how is the feeling?
Yes, doctor, it's just a dull pain.
Okay. So, are you feeling, is it like present all the time or it's coming on and off?
No, doctor, it's almost there all the time.
Okay. So, is there anything which is making it worse?
No, doctor.
Okay. And anything you have done for it to make it better?
Yes, doctor, I have tried taking paracetamol, sometimes 3 times a day also. Sometimes it goes away, but other times it doesn't help.
Okay. I'm so sorry to hear that it's really troubling you a lot. So we will definitely do something for it. And I would like to, can you scale it on a scale of 1 to 10? Like if 1 is the least pain and 10 is the highest pain you have ever experienced, where
Yes, it
would you
will
score
be
it?
around 6.
Okay. So anything else besides the pain you have experienced?
Well, yes, doctor, actually, since a few weeks now, I've noticed that I have to rush to the loo more often.
O- Okay. So since how long it is happening like that?
Let's say 4 to 5 weeks.
Okay. So, are you able to hold the urine till you reach the loo?
Yes, hardly, but yes.
Okay. Is there any burning or anything else you're feeling while passing urine?
No,
Any blood in the urine?
no, doctor.
Any change in the color of the urine?
No,
Okay. Are you feeling that your back pain is going anywhere else also in the body?
no, doctor. It's pretty much the same place.
Okay. And are you like as you said that urine you are not able to hold, so it's more in the night or it's always happening during the daytime and nighttime both?
It's almost during the whole day.
The whole day. And is it affecting this pain and this urine problem? Is it affecting your sleep?
Yes, it is because I have to go to the loo even more now, 3 to 4 times a night.
Okay, I'm so sorry to hear that. Could you tell me, please, that is there anything like you have experienced in the last couple of months? Any change in your appetite?
No, the appetite seems fine.
And what about the weight? Any
Well,
changes in the weight?
yes, I think that my clothes are getting loose.
Okay. So, is it like have you measured the weight? That is there any loss or something like that you want to share with me?
Yeah, I have not measured, doctor. I've not checked my weight.
Okay. But you feel that it's significant that your
Yeah,
clothes have become loose, and
yes.
it's not in. And by the way, it's not intentional,
No, no, I'm
right?
not trying to lose. Yeah, right.
Yeah, that's right. Okay. So could you tell me have you experienced any lumps or bumps anywhere in the body?
No,
Any fever?
no.
Okay. Any
Two
kind of
minutes remaining.
tired tiredness or anything?
Now maybe that's the age. I do feel tired sometimes, but that's nothing worrying.
Okay. So I would like to know that is there any similar illness in the past you have experienced?
No,
By any chance, are you taking any medication for any disease?
Other than paracetamol, nothing else.
Okay. And how is any previous hospitalization for anything?
No,
Any any history of similar illness in the family?
no, doctor, not that I know of.
Okay. And uh, how is your diet?
I try to eat healthy, doctor.
Okay. And one more thing I wanted to know, by any chance, are you do you smoke?
Yes, doctor, I do. For the last maybe 10 years, I smoke 4 to 5 cigarettes a day.
Okay. So have you ever thought of quitting it?
No, doctor, I just like smoking.
Okay, we'll get back to it. And what about alcohol?
No, I don't drink.
Okay. Any cough or breathlessness by any chance you're experiencing?
No,
Okay. Anything else you want me to know?
no, doctor, that's it. I just want to get rid of this pain.
Okay. And are you working?
No, doctor, I'm retired.
Okay. Uh, okay. So I would like to examine. Thanks for the information. I would like to examine you,
Hmm.
and then we will. I will come. I would like to do certain investigations, like routine investigations, like blood tests, and the X-ray of the back
Okay.
and chest X-ray as well.
Hmm.
And I will admit you for, and then we will see. Uh, any findings?
The vital signs are normal. On the examination of the back, there is no tenderness. Straight leg test is negative. And on the examination of the back passes, the prostate is enlarged and it is rough.
Okay. Okay. So Peter, have you any? Do you have any
Sorry, doctor, I couldn't hear you. Can others hear her?
Am I not audible?
No, I'm sorry, I was not able to hear you.
Now you can
Now
hear?
I can, yes.
Yeah. I said, do you have any idea what it can be?
No, doctor. Doctor, I'm worried. Is this cancer?
Hmm. Okay, Peter. Yeah, we will discuss this because this is the first time you are coming to the hospital, so or to the clinic. So
Hmm.
we have planned to do certain investigations for you, and the tests which I have done is few tests are normal, but
Hmm.
unfortunately there is a positive finding that your prostate. Do you know about prostate?
No,
Time
doctor.
ends, but you can continue.
Uh,
No,
Do you know
doctor.
about prostate? Yeah, prostate is a small gland which is it's like near the neck of the urinary bladder. It is there. So sometime when it gets enlarged, usually in the elderly male, they can get a difficulty in passing urine.
Hmm.
But as we have found out that there is a little bit, it's rough, and as you're losing weight,
Hmm.
so I'm afraid that it might be something sinister also. So we need to do certain tests for you, and then only we'll be able to confirm what it can be.
Okay, doctor.
We'll
So,
send
mhm.
certain markers like PSA, that is certain specialized test. I will discuss with my seniors and we'll send that.
Okay, doctor.
Uh, And if by any right now I will just give you painkiller, and if anything,
Hmm.
when we'll plan for the other tests and after the report comes, then we'll give you a call again to come and visit us. In
Okay.
case anytime you feel that the big back pain is very severe or you're not able to pass urine, then you can definitely come back to us.
All right. Thank you, doctor.
Thank you.
Thank you, Dr. Nisha. Thank you very much. Uh, First of all, let me say that as you are in the beginning of the preparation, so practicing a mock like that, it takes so much courage. Thank you for that. Let me just give you a brief feedback on your station. You started really well. That was good. You greeted the patient. You introduce yourself in a very nice way. You confirm the name and age of the patient. That was absolutely fine. And one very good thing, you show empathy to the patient that okay, you are in pain. And it's important that whenever the patient says that I'm in pain, you have to say, I'm really sorry that you are in pain. Are you comfortable to talk? And then you proceed onward. Most of the time the patient will say, yeah, I'm comfortable. They're not gonna mess up with that thing. And then you have to just to add on some IPS lines. You can say, okay, thank you very much. I will ask you a few questions and then I will assess your situation quickly so that I can relieve your pain accordingly. Okay. Then you move on to the history. You asked about the details of the pain. One very important thing in the PLAB to exam, like previously we discussed, what are the 10 main areas on which they assess you. One of them is a consultation, and consultation includes that your questioning or your consultation is going smoothly, like you are moving from presenting complaint to the history of present illness to the past history and to family history and then to the examination. Like you are not moving haphazard. So you asked the questions about the pain. That was really good. You missed one thing, the radiation part, which you asked later on after you asked the urinary symptoms. And then you realize that you have missed the radiation part and then you ask that question again. Okay. uh, so that was just a slight mistake. Then you asked an open question like, is there anything else apart from the pain, which is very nice. Don't jump straight forward to the specific questions. Always ask the non-specific open-ended question, because it will make your life easier as well. Because the patient directly told you, yeah, I'm having this urinary problems. Because otherwise, if you will just jump to the specific question, you might need to ask 3 or 4 questions to reach to the actual point. What is the associated problem with that? That was really nice. You asked the open question. And then in the urinary symptoms, you asked about the incontinence, you asked about the burning, you asked about the blood and the color change of the urine. One important thing which can be added is the fever, because you just want to rule out if the patient has any UTI. Because even if you are suspecting that the patient is having a problem with the prostate, like benign prostatic hyperplasia, still that is a risk factor. The patient can have a UTI with BPH as well. That's a different station anyway. So it's important to add a question of fever over here. One more thing is a few more questions about the urinary complaints. For example, the weak stream of the urine. Okay. And one more important question is that you have to ask the patient about the dribbling. And the phrase used to ask that question is like, uh, by any chance, after passing the urine, do you feel that your underpants are stained with urine, or you feel like any drops are still dribbling? Okay. Then you moved on to the sinister questions, the red flag questions: weight loss, tightness, appetite, lumps and bumps, which is really nice. Uh, and then you moved on to the past history. When you ask the patient about the past history, even if the patient says, no, I don't have any medical condition, so you have to relate his presenting complaint with a few of the known risk factors and ask him those specific questions. Like you can ask the patient, do you have any problem with the prostate previously? Okay. Allergy questions are really important here. Any instrumentation in the urine tract is also important. Uh, and then you asked about the smoking. That was fine. You also asked the patient that, have you ever tried of quitting the smoking? You don't need to go into that much detail. Okay. Of the smoking history over here. That will come with the time. You will know that what question you need to tailor according to the situation. Okay, I'm just telling you one particular over here, that uh, it is not important to go into the details of the smoking history here. You asked about the alcohol. That was really good. And whenever a patient tells you that he's not smoking or he's not drinking alcohol, just give a slight appreciation to the patient. Oh, that's really nice. That's really good. Okay, because it will add to your interpersonal skills. Okay, then you again ask a question like, is there anything else you would like to tell me? That was fine. Like, if there is any positive finding in the history which you have missed, the patient might tell you, or he might just say, what do you want to know, doctor? Or what else, doctor? Or maybe he say, I have told you everything you have asked. You also asked about the psychosocial history, like if it has affected his daily routine and the work. That was really good. Uh, Over here, when you were feeling probably the pressure of the time, then you messed up a little bit in the examination part. Till the data
Mhm.
gathering of the history part, you were really nice. And then I think that you were feeling the pressure of time, and then you missed one thing. Whenever you have to whenever you have to do the examination, you have to verbalize it, that what exact examination you would like to do. Okay, and you were expecting that as an examiner I will give you some findings. So if you will do this thing in the actual exam, you won't be given any findings at all, because I don't wanted it to make it difficult for you, because I understand you are just in the beginning of the preparation. So I give you the findings of the examination. But remember it, you will have to verbalize specifically that what examination you would like to do. Only then you will be given the examination findings by the simulator or the examiner. Okay, like if you won't mention that I would like to examine your back, I would like to do the straight leg raise test. Okay, so they don't give you the findings unless until you have mentioned specifically. Okay. Anyways, I gave you the findings, and you also mentioned about the initial test. It's better if you mention that what initial test you would like to do, and the relevant one here are like the baseline test, CBC, LFTs, RFTs, serum electrolytes, and the urine complete examination. So you can say it, I will do some routine tests to check if you have any weak blood. Weak blood is a term used for anemia. It's a layman term. And I will do some tests to check the function of your liver and the kidneys and the mineral content in your blood. And I will also do a examination of your urine. That's fine. Then you asked about the idea of the patient. This is very important that you have to ask the ideas and concerns of the patient in the consultation to make it a patient-centered consultation. That was a nice approach. But when the patient told you that, doctor, is it a cancer? Whenever, whenever a patient raises a concern about a cancer or any serious condition like a heart attack, you have to ask the patient, may I know why do you think so? Okay, because he might have some background in his mind that why he is relating his symptoms or why he is concerned that it can be a cancer. Okay, so always ask the patient, if why do you think it's a cancer? And then when the patient has raised a question himself, that is it a cancer, he has made your life a little bit easier, the management part. So the next thing, the next approach is just tell the patient that the way you explain that this is a problem with the prostate, and then tell him, I'm not sure at the moment what it is. It seems like it is a problem with the prostate, but as you have a concern that it can be, if it can be cancer, it can be many things. Considering a best case scenario, it can be just an infection or a enlarged prostate, which is a normal aging process. But unfortunately, sometimes it can be something serious, like the way you are concerned about the cancer. But at the moment, I'm not sure. Then involve the patient again. In the management part, the management is not just the management of the medical disease. You don't just need to uh, tell all the medical details to the patient. Involve the patient, like if he has understood what you have already told him, does he have any questions so far? Okay, involve the patient. It will improve the marks of your interpersonal skills. Okay, so after explaining the diagnosis, you ask the patient, do you have any concerns so far? Or the patient might ask like, but what would you do for me? You mentioned that you will give the painkiller, but you mentioned it a bit later in the management part. So initial things first. The pain management is the first thing. Next thing is to involve a senior. Whenever you think that the condition of the patient is something serious, involve the senior. Okay, so after giving the painkillers, the next step is to involve the seniors, and then you will have to tell the patient that we will do some specific tests for your prostate, like the way you mentioned the PSA, that was really fine. And then you have to tell the patient specifically that we will refer you to a specialist doctor in a 2 weeks time, or you can just say we will urgently refer to you. In the UK, urgent referral means the 2 weeks time, and for any cancer, 2 weeks is the urgent referral time. If you are suspecting a cancer in any patient, you will have to refer the patient, and you have to specifically mention that we will urgently refer you or we will refer you within 2 weeks time. Because if you will just vaguely say that we will refer you to a specialist, you will be marked down in the management part because you didn't mention that it's urgent condition. Okay, and that again depends on that if the patient wants to know what the specialist is going to do or not. That's not exactly in your domain. If you have time, you can cover that. You can ask the patient, would you like me to tell you that what specialist is going to do? If he says yes, then you can tell him if you have time, or just the way you concluded it. It was not necessary to go into so much details of the suspected prostate cancer or its treatment option. That depends upon the patient if he wants to know it or not, and secondly, if you have the time or not. And on the last, you mentioned the warning signs. So warning signs associated with this condition, if you are suspecting that the patient has a prostate cancer which has metastasized to the spine, so one of the possible complication can be spinal cord compression. So you will have to tell the warning signs of the spinal cord compression, that by any chance you feel any weakness of the legs or numbness in the legs, or you feel the numbness around your back passage, or you have any problem in passing the stools or urinary retention, you have to come to the emergency department right away and don't wait for your regular appointment. Okay. And one more thing I would like to add over here is in the history part, when you move from the history of present illness to the associated symptoms, and you want to ask a few red flag questions, like the way you asked about the weight loss, tiredness, or the blood in urine, the patient might get alarmed because he might not be expecting these serious type of person. So it's a nice idea if you just signpost by saying that now I'm going to ask you a few more questions just to make sure I'm not missing something. Please don't get alarmed. And then you will, even if you will ask like, have you noticed any blood or have you noticed any change in the weight, he won't give you any absurd expressions. So overall it was good. uh, the history part was really good, and in the management probably you were feeling the pressure of the time. And one more thing is, Dr. Nisha, uh, you are a doctor and the simulator is a patient, so the scenario should be like you should be more confident than the patient. It should be not like your voice is shaking and you are not being confident. So in any station of the PLAB 2 exam, you have to be confident even if you know nothing about that station. Okay, because it gives a slight negative impression if you are just like memorizing the question, recalling them, and your voice is a bit shaking. Okay.
Right.
Okay, so everything understood so far? Anything specific you would like to discuss?
No, I just wanted to ask one question regarding the past medical history. So, like as you said, because
Mm-hmm.
if we have made, like yesterday also you told that when we have made a formulation, like okay, this can be the diagnosis. So past medical history, we
Mm-hmm.
can ask related to, we can say like okay, any past history of prostate illness, we can specify like that doesn't matter, right?
Yes, it doesn't matter. Uh, when you are suspecting a clinical diagnosis based on the history and you have moved to the past medical history, you can ask a few relevant questions specifically, even if the patient says, no, I don't have any medical condition. Uh, Generally, we ask about the raised blood pressure and the diabetes, but those are not the relevant questions over here. Okay, you can ask them if you have time, but it's not important to ask a question of raised blood pressure in a suspected case of prostate cancer. Are you getting me?
Yes. Yeah.
So you can specifically ask. And so just to conclude it, uh, number one, your greeting and start of the session was really good. Try to be more smooth in your consultation. If you have forgot one thing, just forget it. Don't ask that question later in the later part of the consultation. Okay? Don't reflect back to the history of the present illness when you are in the past medical history. Okay, and with time and with practice, you will get better with this thing. You won't need to struggle with it. Okay? And always remember that you will have to verbalize what examination you would like to do, what specific investigation you would like to do, because otherwise you would not be given any examination finding and you won't have a diagnosis and you will struggle in the management part. Okay.
Right. Thank you so much.
Okay, thank you. Dr. Aruz, let's move to the next mock.
Yes, so Dr. Adnan, I think we should stop the meeting and start the other one. There's 3 minutes remaining only.
Okay, you can start.
All right. Thank you, participants. We'll be sending you another link. Please join that link again, and we'll be taking our second mock.